Colonoscopies are not a test of gut health. They never have been. Yet they're still the first intervention mentioned when you tell your GI doctor that you've got chronic constipation, cramping, bloating, or diarrhea that won't go away. Clean yourself out and let's stick a camera up there is the first intervention. And then you're told everything is normal after having one while you're still living with chronic diarrhea, bloating, cramping, and urgency. Colonoscopies became widely recommended in the late 1970s and early 80s as a screening tool for colon cancer. That's important. They were designed to look for tumors, polyps, ulcers, bleeding, structural abnormalities, in other words, visible pathologies. They were never designed to assess real gut health, things like the microbiome, digestion, inflammation at a functional level, or why somebody has chronic diarrhea, bloating, or IBS symptoms. But somewhere along the way, colonoscopies became positioned as this gold standard catch-all test. And that's where the problem starts. Here's the truth that shocks my clients every single day. A colonoscopy cannot tell you how well you're digesting food, if you're deficient in beneficial bacteria, if you have pathogenic bacteria that's driving your symptoms, if your fatty acids like butyrate and acetate are imbalanced, if your gut pH is off, if you've got yeast, parasites, or bacterial overgrowths, if lipopolysaccharides are triggering inflammation, if mycotoxins are damaging your gut lining. None of that shows up. And it doesn't show up on blood work, CT scans, endoscopies, or the basic stool tests that most doctors run. So when women say, I've had multiple colonoscopies and they didn't find anything, that's actually not shocking at all. Your problem isn't a tumor. It's not a blockage. It's not an ulcer. So of course nothing showed up.